Hi, everybody. Cary Ganz here, Dr. Cary Ganz. We're here in Garden City waiting for my first patient. Our office is right across from the new Neiman Marcus, right across from Roosevelt Field. And I wanted to talk to you today about something, what I call the uniqueness of dentistry, the uniqueness of the practice of dentistry. Why is dentistry a unique health profession? This came about yesterday afternoon, and I say this all the time, and sometimes I don't think about it because I've been doing this so long that you tend to think about, you say things without thinking about how important they are. So I thought I would just go on and chat a little bit about why is dentistry so unique. Well, what comes to mind is the fact that I have a bunch of kids. I have a ton of them, and they're all very successful. I have three older and one younger, and they're all in their own ways extremely successful. A bunch of them are physicians. They're plastic surgeons and orthopedic surgeons and pediatricians, and they do all kinds of great things. But there's one thing we can do that they can't do, and that's fix everything. And that's really why dentistry is so unique. You see, there's really nothing that can come about when it relates to oral health, for the most part. And I'm talking about more the day-to-day things that we see in the office. We're not talking about devastating disease, because that more or less falls into the realm of the physician. The diagnosis may be part of what we do, but the actual treatment becomes part of the physician in the physician's realm. But for the most part, the day-to-day operation, the loss of teeth, the replacement of teeth, the maintenance of teeth, things of that nature, we can fix it all. The nice part is when I walk in my office in the morning, I know, especially as a prosthodontist, that there's nothing I can't fix if the patient wants it fixed. Now, you can't say that about medicine. Now, very often you walk into your physician's office and there are things they can't fix, or they can't fix totally. And the reality is that there's nothing that I can think of, for the most part, and there's always exceptions, but for the most part, that we can't fix if the patient wants it fixed. And we have the tools today to pretty much do. We can go ahead and replace teeth. We can put crowns on teeth. We can use composites and bond to teeth. We can go ahead and diagnose in ways that we couldn't do before. We can make crowns and caps and bridges in a day. We can go ahead and use implants to replace one or more missing teeth. Nobody in this country, for the most part, needs to go edentulous any longer. Nobody needs to wear dentures if they don't want to, if it's really important to them. Now, of course, finances always comes into play. That's an unfortunate part of our society. Money does play a role. But even that, for the most part, if somebody really, really wants something, there are always ways of getting it done. There are financing plans that we have. There are ways of planning the treatment out over a period of time so that it doesn't become a burden over the short haul, and we can go ahead and extend treatment over the long haul so that the finances aren't as difficult to bear. But once again, that's the uniqueness of dentistry. It's really a hi, Sam, good to see you. And I think, Sam, I have a dentist on the call right now. Good to see him. And I think he'll agree that that is really the uniqueness of what we do. Now, we come in every morning and we know we can solve problems. And truly, if we can't, we have resources available to us to go ahead and do that. Now, to give you an example, I don't do root canal. Why? There's a bunch of reasons, but I don't do it. As a prosthodontist, I more or less deal with the restorative aspects of dentistry. But if an endodontic problem comes up, I can send a patient to the endodontist and they will solve that problem. Now, with rare exception. And if the problem can't be solved, that doesn't mean we can't give a patient a goal of a healthy dentition. That's my computer starting. There's always a way to do that, even if a tooth has to be lost. And today, that's a relatively rare circumstance. But if a tooth has to be lost due to fracture, due to severe neglect, etc., we have ways of replacing them and putting you back into total good health. Now, same thing goes with periodontal therapy. Now, what that requires is not only the cooperation of the patient, it's something the patient has to want. I mean, nobody really wants to go to the dentist. We understand that. We've been doing this long enough, and I'm sure my friend Sam will agree that nobody ever wants to go to the dentist. It's something we sort of have to do. But the reality is, it's one of those things that we do that can return to us in 100 times over. Having a healthy dentition, having a great smile, it just can make your day. It enables you to go about your day in a different way than if you have constant toothaches, if you have loss of teeth and you can't smile and you wake up in the morning and you've got bad breath or your gums bleed. And this is not a way to live. And the answer is that we can fix it. So that was really the whole purpose of this call, is to discuss really why dentistry as a profession, I believe, is very unique, especially in the health professions. There are things that other healthcare professionals just can't do, and they can't fix everything. I can't think of offhand, anything that we can't take care of, where there isn't some solution. Now, some of the solutions are complicated, no question about it. Some of the things we do, take time, require effort, require participation. But at the end of the day, you can have a full, healthy dentition. So that's really my story. If you're somebody out there who is facing dental problems and just think they can't be resolved and there's no answer and I'm just going to lose all my teeth and I'll never be able to smile again, if you're here in New York, give me a call. Even if we just talk about it on the phone, happy to chat with you. If you're somewhere else, just find a good dentist and sit and talk with him or her and let them know your concerns and find out what the solutions are. And there are always, once again, when we talk to patients, there never really is only one solution. That does happen, by the way. Sometimes there is only one solution, but that's not the norm. Very often there are multiple ways of handling problems to get you back and make you whole. So, and anyway, Dr. Cary Ganz, if there's any questions, I see there are a bunch of people on this morning. I guess a lot of people get up early. If there are any questions, happy to answer them. So just type them into the box. I'd appreciate, as always, if you would share this so others can benefit from it. If you're here in the New York area or you're on Long Island and you like to, stop by and meet with us and chat with us, we're right here across from Roosevelt Field in Garden City. You can always reach us by phone, whether you're here or anywhere in the country, and you just need to get an answer or toss something past somebody. Always reach us at 516-741-1230, or go to gansdental.com, GANZDENTAL.com. There's a ton of information there about a wide range of dental services. Once again, whether you're here on Long Island and you want to become a patient of ours, or just need some information so that you can go to your dentist and ask the best questions. Tell my kids all the time, there's no such thing as a stupid question. There are stupid answers, but there's no such thing as a stupid question. So feel free to ask us if you have a question. If we can answer it, great. If we can't, we'll find the answer for you. But go out, go see your dentist, and understand that dentistry is a profession that, for the most part, if you're willing, we're able. And we hope you have a great day. Please pass this information on to others, just to let them know there's always hope. There's no aspect of dentistry that can't be taken care of, whether it's through caps and bridges and implants and whatever. There's always ways of taking care of things. There are lasers out there. There are CADCAM technology, 3D technology, all kinds of things available today that just 10 years ago were not around. So speak to your dentist, converse, chat, ask the right questions. If you can't get the answer, that's why we have Google. Have a great day, and we'll see you at the next chat.